Welcome back to another live stream. We are missing Layla. I think she is trying to come in. She's from Nottingham as well. She's replacing Izzy today, but we'll just give her a few more minutes. That's fine. How's everyone doing? We all okay?
Great. Yeah. It's a wonderful Tuesday.
I know, yeah. So Roger's just going to say something quickly about Peter and his whereabouts.
So unfortunately, Peter has been delayed through a little emergency. Here's Layla. I'll just add her quickly. Hey, Layla. Unfortunately, Peter's been delayed slightly. He has been doing some work on an elephant calf at Herd, which is the Hoedspruit Center that works with rehabilitating elephants. Basically was working with this elephant last couple of weeks and had a little bit of an emergency, so had to shoot over to go and do a blood transfusion on this calf. So he's running a little bit late. We're going to keep an eye on things and see when he's able to join us. But so we've rejigged things around a little bit today. But in the meantime, I thought I'd just show a quick video of exactly where he is and what he's doing. Just to bring you guys up to speed. So check this out.
So here we are at Herd, the Hoedspruit Elephant Research and Development Orphanage just outside Hoedspruit with Aline, the owner, Aline Rudder. This little elephant came in last night. It had been caught in a snare, and it was darted in the Greater Kruger and brought through by a vet, Dr. Gerrit Skeppers, who offloaded it here last night. So we came out here today. He took off the snare, but he wasn't able to actually clean up the wounds, so we've done a standing sedation with her, and we've managed to clean up the wounds nicely. Most importantly, she's very dehydrated, so we're going to give her a drip, intravenous drip. By the time we finished, about 15 liters would have gone in, and then just clean up the wounds with peroxide and chlorhexidine, and put some Stockholm tar on just to kill the maggots and to keep the flies away, and basically given her vitamins and minerals, more antibiotics and anti-inflammatories. So this was basically just for the first aid. When she gets a little bit stronger and more hydrated and starting to eat, then we'll actually, this big gap on top where the cable was, it's about this wide, we're going to suture it together. Because this ear at the moment is not really working. You can see that the cartilage here at the back is, you can see the cartilage actually torn here. So what we might do next time is try and to get these, or somehow get some of these edges together, and see if you know that can work. It will never ever be 100%, but at least if we can get some more strength in this ear, that it can actually start flapping again. Okay. And then underneath here was the main wound. You can see I've got like a cotton wool swab in here. You can see the maggots even coming out now. A whole lot of them, this black stuff, the Stockholm tar will kill them and it'll stop any others coming in. But there are literally hundreds in there. You know, you can spend 2 days trying to get them out, but this, what we've done, will kill them all. So I'm not worried about that at all. So yeah, I think we've arrested the development of any further infection or inflammation. And the maggots, to me, are probably the most important thing here, that we've got rid of them. So we'll look at her over another 5 days or so. And we'll check, because the next time we'll have to actually immobilize it completely, and so we can actually clean that properly from underneath, and then we'll suture that closed. So all right.
Awesome. Thank you, Doc.
But it shows how weak she really was, because I mean that dose we used of BAM was not high at all. See, she's starting to wag her tail. See that, Joshua, when the elephants wag their tail like that, they're about to charge. Yeah. And they wag their tail like that.
You've got elephant experience.
Doc, can you tell us about the blue spray you use, please?
Okay, that blue spray, what it is, it's just an antibiotic spray. It's a oxytetracycline spray. And the blue is just, it's a marker, so you can see where you've actually sprayed. The antibiotic itself is colorless, but the blue just shows you where you've actually sprayed it on. And it does tend to dry out the superficial wounds as well.
So unfortunately, the sound quality not the best in that. We do actually have another video which goes into a little bit more detail, which we can show in a minute. But maybe first of all, just back to the panel again. Re-welcome to Layla. Sorry for cutting you off. Thanks for joining us.
Sorry, I had some technical difficulties getting on.
Don't worry.
Everyone, this is Layla. She's on the NUVZS committee at Nottingham as well as our social set. So she's just replacing Izzy just for today. We're hoping to kind of see more of NUVZS committee, and we'll introduce some more of them in the near future. But yeah, welcome, Layla. Looks so sorry for herself, may I just say. Looks so like just beaten.
I know. So just an update for those of you who just tuned in. Dr. Rogers is delayed doing a follow-up with that exact calf that you just saw in that video. Unfortunately, the news on the street is that that little Ellie calf is not doing too well, and they're having to do a emergency blood transfusion this evening. So he's going to try and join us as soon as he can. I wanted to ask the panel, I do have another little bit of footage which goes into a little bit more detail, which is about 1.5 minutes long. Shall we show that? Do you think that's part of that? Okay, let's chuck it in. Here we go.
This is a little elephant that came in from the greater Kruger with a snare around its neck and through its ear. It was brought to us here at Herd, which is an elephant orphanage just outside Hoedspruit. And very lucky enough to have the expertise and the facilities and the staff to handle an animal like this. Lots of experience. The owner, Rhino, who's busy picking up maggots there. And yeah, we've got a standing sedation here with BAM. We've spoken about BAM, and this elephant, we've cleaned up the wounds with peroxide and with hebetane, chlorhexidine, and then we've injected it with antibiotics, Batrol, Exceed, and we've got it on IV fluids. It's got 12 liters in so far. You can see the back here. We've given it Exceed, Dectomax for the maggots and deworming, and Finidine, and this is the extent of the wounds are quite bad underneath, even worse. Just open here, Joshua, for me. You can see right underneath here. This is probably where the knot was, and lots of maggots and stuff that have come out there. So this is just the standing sedation with BAM, 0.1 mil per 150 Ks. So we estimated her to be about 400 Ks, so we've used 0.27 of a mil. And this was about an hour ago, so she's doing really, really well. We've managed to clean up all these wounds and just do some basic first aid. If you look on top of the neck here, on the back, you can see these wounds here. Now, next time we will knock her down and we will actually just suture these wounds together. But today was just first aid. She's very dehydrated. She's got about, we're going to have, by the time we finish, about 15 liters of fluid intravenously, and vitamins and minerals, antibiotics, deworming, painkillers and anti-inflammatories. And the big thing is now is to get her to drink, because they're only weaned at about 4 years, and we expect, but we suspect that she's about 2.5. So that's the lady, and we're going to wake up shortly.
So yeah, that's footage from Dr. Rogers with that elephant calf a couple of weeks ago, and now has just had to go over to do emergency blood transfusion. So hopefully we'll be able to catch up with Dr. Rogers more towards 6 p.m. UK time. Hopefully he'll be back in time. But in the meantime, I believe we've got something else planned.
Yeah, I mean, I'll introduce it, and then maybe Kat can take over. Oh, gosh. So we've kind of decided that we created this kind of idea of doing a journal club, kind of finding some interesting journal articles on wildlife and wildlife veterinary medicine, zoology, kind of anything kind of related around what we want to do, like conservation and things. And Kat has kindly found us a wonderful article on lymphoma in a cheetah. And it's like a case study, and it kind of talks through it. So I posted it on my NUVZS Facebook account. So some of you guys might have seen it already. I don't know if you guys have as well. And yeah, we're just going to have a little chat through it about the pros and cons of it and kind of what it discusses. So Kat, over to you.
Hey everyone, just checking, can you hear me all right with the headphones? Fab. Okay. Yeah, no, so basically you will have found that, like with vet school and stuff, we don't tend to discuss a lot of papers, and we don't discuss any papers in most of the courses, and we're not really given a lot of the course material is always given to us. We're not really given that opportunity to like test our intellectual boundaries as much. So hopefully some of you guys have read the paper. If not, it's absolutely fine. Basically all the information's in the abstract, so you can definitely follow along. I will share my screen and I'll have the paper up, and we'll just go through some of the sections, and me and the panel will just give some of our opinions and stuff. And if you guys have anything else you want to add in, you can definitely go and type in the comments and stuff, and I'm sure they'll pop up. If I'm sharing screen, I think I won't be able to see your guys' video and stuff, so feel free to interrupt me at any time and just say there's a question, or I'll check in with questions and stuff. Let me attempt to share screen. Okay. So you should be able to see the paper now?
Yeah.
Yeah, fab. Okay. So, right. So the paper, the title is it's looking at multicentric T-cell lymphoma and cutaneous hemangiosarcoma in captive cheetah. So this paper was published, by the zoo in the States. And so it's basically discussing a case in one of their male captive cheetahs. If you're in your preclinical years, both of these are basically cancer forms, both the lymphoma and the hemangiosarcoma. But they'll discuss a bit more as well in the paper. So this, from the other papers and stuff that I've looked at, this, ignore my highlighting, that was just some bits that I've picked up on and stuff. But so from this paper, I think is quite unique in the sense that it's like a proper case study write-up. A lot of papers that you'll see, and the majority of, not majority, but quite a lot of scientific literature, especially revolving around biomedical sciences or statistical studies, will be like laboratory. They'll be standardized. There'll be a control group. They'll have done like lots of statistical analysis and stuff, and their results will be quite reliable in such that you can draw solid conclusions from them and go ahead in the future. With this, it's a bit different. It's a case study based on one animal, and it's describing all of these studies, all the findings they have found. So just bear that in mind, I guess, when we're going through it. So I'll leave the abstract there on the screen so you guys can have a quick glance through it if you've not seen it before. But just over to the panel, any like initial feelings or thoughts about the paper and the abstract and how you found it?
Kat, as you mentioned already, the abstract itself is the abstract itself is a really good summary for what the rest of the paper describes. So like you said, if anyone hasn't managed to have a chance to read it yet, don't worry, because this gives you a really good overview. It's a complete and quite concise summary, and then we'll see as we go through. I thought there were quite a lot of repetitions throughout the paper on a lot of these things that are mentioned in the abstract. but has its pros and its cons. That I suppose it gets those key buzzwords in your head, but at the same time, it's is the information still relevant as you go through?
Yeah, definitely. Anyone else from the panel have anything they wanted to add?
Yeah, I thought it could be a bit more structured. So I mean, we'll talk about structure a bit later, but yeah, that was my initial first thought as well, like a first impression thing.
Yeah, absolutely. Yeah, I think obviously if any of you guys have any comments and stuff, feel free to type them up, and one of the other panel members will just read them out and we'll just discuss that point as well. I think, yeah, like as in general, like the abstract is really, really descriptive. It's got everything they need. It's just covered basically all of the clinical signs. So if you wanted to stop reading at this point, I think you definitely could. I think the important bit of this is basically, so they had this 13-year-old male cheetah, and they've had 4 months history of kind of in and out clinical signs, lethargy, increased expiratory effort. And the notable thing for me is that he basically died shortly after his sibling died of a related ish cancer. So he died from a hepatic T-cell lymphoma, whereas this the cheetah that they're reporting on died from a multicentric T-cell lymphoma. I think the other thing is, so at the bottom here they do say that like this is the first case of cutaneous hemangiosarcoma and this type of cancer found in an FELV negative cheetah. So you might know, for those in clinical years and stuff, you might have heard of FELV, which is feline leukemia virus, and it does tend to affect large cats as well as domestic cats. And the assumption that I'm drawing here, and obviously it's not clearly stated, is that cats with FELV, like FELV positive cheetahs, are either commonly get these cancers or they've been reported in the past. But again, there's not a lot of like reference to why they think they're the first ones to report such a thing. Like, it's a pretty big claim. But yeah, anything from the comments at the moment? I'm gonna make this a bit bigger. Hello?
Nothing coming into the comments just yet, no.
That's fine. Okay, well, we'll move on. So basically throughout this paper discussion, the things that we're kind of trying to focus on and that we're trying to pick up on is just like the positives of the paper, where they did well, where they may have like had weaker areas that they could have improved on, partially in the actual clinical methods that they used, but also in the actual write-up and communication of the paper. In my opinion, if you're going to write a paper, and if you're going to get something like this published, I think it's really, really important that it's like the information is easily communicated and like easily referenced for others to use in the future. Because otherwise, I guess, not so much as what's the point, but as in you have an aim to share this with the world, and you should aim to do it in an easily readable way, I guess. So the paper then launches into a brief communication, and if you've read the abstract, or if you've read the paper, you'll notice that this first entire paragraph is basically a copy and paste of what the abstract is, and it's almost arguably unnecessary to have here, just because I think if you start reading the paper, you've read the abstract first, and then you are rereading this. Not really sure how relevant it is, but again, like, although that is a valid criticism, it's probably not that relevant in terms of like their clinical methods, and it doesn't really doesn't take that much away from the paper. But yeah, so if any of the other panel members, I don't know if you guys had anything to say about the general like introduction, I guess, to this. It's not really an introduction, I would say, but or if anyone in the comments and stuff has anything they wanted to add. I think here I made a note that it was, just not amazing writing, just for the repetition.
Yeah, just one thing we picked up on, obviously you've mentioned that the signalment of the animal, so the age, weight, description of species is all very much included, but there isn't much given in terms of the background of the husbandry or the management of these 2 cheetahs, and that's something that I felt was missed throughout the paper. We very much get an in-depth look at their clinical status, but we don't really hear so much about the husbandry, and as you mentioned, if you are perhaps someone reading this and worried about your own captive animals, or a veterinarian with, looking after similar animals at another establishment, you may want to look at other factors which I suppose could affect these animals, such as their environment or how they're managed.
Yeah, absolutely. That definitely wasn't mentioned, and it's definitely, I guess, like with exotic animals and stuff and wildlife, one of the primary preventative medicines is always husbandry. So it would almost have been it would be very useful to have had that included, even just in brief notes. But yeah, Yashu, Molly, I don't know if you guys have anything else to add, or Layla as well.
No, I agree with most of that. I will say I do like how descriptive they are. So I think that's one thing that this paper does really well in general. I like the detailed descriptions. Of course, being descriptive can only take you so far, but it is nice. I think they did a good job with it. So yeah.
Yeah, absolutely.
Yeah, no, I just agree with everything that's been said, to be fair. And yeah, I guess being descriptive, there's a line, isn't there? There's a point where being too descriptive is kind of waffly, but I don't think they get too far into that, which is quite good. They are quite succinct, which is obviously really useful. Like you said, Kat, you want the information to be gotten across in the best way possible.
Yeah. I think for me, one of the things, like from reading other scientific papers and stuff, and obviously this is different because it is a clinical case report, but if you look through the paper, basically there is the brief communication is basically the only subheading. So the rest of the paper falls under brief communication. At that point, I'm not sure it's brief. What almost would be nicer, or what almost I think would have made this paper much more impactful, would have been a brief introduction about the I'm assuming probably not a lot is known about cancers specifically in cheetah, but even just referencing prevalence of these type of cancers in house cats, and prevalence of FELV in cheetahs, and prevalence of just general I guess just a general introduction to why this is so important, and why they think this is the first one, and kind of how often this might happen, and kind of thing. I think as well, if you're the paper is obviously aimed at other clinicians looking at their own animals, but it would almost be nice to have even just a bit more layperson speak, I guess, in terms of some of the signs, or some of the all the words are incredibly descriptive, and the description is really, really good. But I think it is missing that introduction, and introduction into the topic. But yeah,
Kat, we've had one comment come through from someone that was related to the writing format, and they've said, when reading it, I realised it was not broken up and organised like a traditional research article, as you've just mentioned. But I figured that may have been due to it being a summary of a case rather than an experiment.
Yeah, no, I think I agree. It's definitely if you have read any of the scientific paper, they're typically broken up into their introduction, their aims, and then they'll have their methods and their results, and then discussions and conclusions all separate. I think it's possibly it is just because of the case study, but I think regardless if it's a case study, personally I would have preferred to have just a bit more broken up. So if I wanted to find, just like me, if I was looking at a cheetah later and wanted to find one specific aspect of the clinical signs that maybe they mentioned, for example, here they start going on about the radiographs. So it would have been nice to just have that as a slightly separate paragraph. So if you wanted to just reference that, it would have been easier to access, I guess. Again, it might be me being lazy, not wanting to read it all again, but you know.
No, but it goes back to ease of access and access of information, and presenting the information correctly and in the best way possible. It's exactly the same thing. If I'm trying to find keywords and screening a paper and it's not that obvious to me, then I'm not going to read the paper.
Yeah, no, absolutely. But yeah, I think it does continue quite a bit. If we want, so part of all journal club discussions and stuff is always just analyzing their figures and analyzing the data that they're visually presenting. Does that match up with what they're saying in text? And obviously so here I'm just going to scroll back up. Sorry if this is dizzying for anyone. So here they mentioned that they've taken orthogonal radiographic views of the thorax and abdomen, and so these reveal their like well-defined multilobar soft tissue opacity, and they describe it quite well as to how big it is and all that, and like the other radiographic signs and ultrasound signs. They then go on to only include one figure, which I don't know if anyone else wants to comment on.
Oh, well, I think maybe more than one figure could be nice. But I mean, as far as the radiograph goes, like it's pretty solid radiograph itself. So I'm not sure if anyone else wanted to jump in on that.
No, I think in general, like they have a good, like the actual radiograph itself is good. They've got their little arrows pointing to what they're referring to. But I think they've mentioned that they've taken several radiographic views. It would be nice to see that. And another thing I think that would, again, if you are a zoo vet or a wildlife vet, you're probably more familiar with cheetah anatomy on a radiograph. But even so much as different dog radiographs like change between species, not species, breed, sorry. So like an Italian Greyhound radiograph looks different to that of a Labrador. It would have been nice to see maybe a normal radiograph alongside it. And I think, like, I am obviously not doubting the fact that these masses were present, but it would be much more obvious if it was compared to a normal thorax. But yeah, overall, I think, yeah, go on.
Sorry, and just also the point that having a second, radiograph allows someone to try and interpret the images and make their own diagnosis, because obviously we can read the paper and assume that that's correct. But I suppose there's always critical analysis, and sometimes people might disagree with what they see on a radiograph. I know for a fact that I sometimes don't see things that other people can see, or vice versa. So the more evidence, I suppose, that you give to back up your case, the stronger it is.
Yeah, no, absolutely. I think as well, yeah, they're making such big proclamations. This is the first type of this case in this cheetah, and if someone was wanting to contest that, or if someone was wanting to actually no, what you're seeing is something entirely different, they would only have one radiograph to base that claim on. So as well, I think personally it would have been useful to see more views of it. One thing to consider is when papers get published and things, they sometimes have a word limit or a page limit, so it might just not have been feasible to include it, so they just chose the best one and may have included the extra ones in supplementary material. But yeah, just something to consider.
And we've got another comment pop up from Izzy. Hi, Izzy. She's saying, amazing session, thank you. She's also, I was just wondering whether the specific requirements of the journal that the paper's being published on in could influence the data presented, particularly in pictures, and as you've just mentioned, I suppose, word count as well. Is that something that we see?
Yeah, so I think, this one was published in Journal of Zoology or Zoo Medicine. I will just scroll up to a Journal of Zoo and Wildlife Medicine. So given that it is a published paper, they do tend to have a bit of a word limit. It definitely varies between papers. But my argument is almost they could have almost added in another image and condensed, for example, some of this information into a table that wouldn't have counted in terms of words, or the other thing is, if they thought that those other radiographs were useful, they probably would have included. So something in them has made them think that, you know what, this one is enough. But yes, no, that definitely influences papers. It definitely is quite frustrating sometimes to read a paper and the first 6 points that they're drawing conclusions from is oh yeah, see supplementary data, see supplementary data, see supplementary data. And you're like, oh, okay, right. You either didn't have enough words or those figures weren't pretty enough for you to include in your original paper, sorry. But yes, no, it can definitely influence in that. I think in general, yes, we're still under brief communication. The whole paper is under brief communication, and they do just talk about all of these, all of the clinical signs that they found. I think this, yeah, so this comment was just in general, like the paper is very descriptive of the clinical science and the clinical findings. So in general, like this case is almost meant to be so that you could use this to diagnose future cheetahs with similar signs. You could consider this to be one of the on your differential diagnosis list. I think one of the things that we were thinking was just some of this data, as I mentioned, could have maybe been presented in a table. And for example, so this here states that they've rechecked the CBC and serum biochemistry, and it would have been nice to almost have it like side by side comparison with how it changed between times that they've looked at it again, so you could just see progression of disease without having to go into the paper, find it yourself, write it out on a list yourself, if that makes sense. But yeah, I don't know if anyone has any else thing to mention here. And obviously keep the comments coming. They're absolutely great. If not, we'll just discuss these next. Well, figure 2 and 3 here. So anyone from the panel, if anyone wants to comment on what they think about figure 2 specifically.
Yeah, my first thought is, it's black and white. I am obviously really happy that they included a picture. I think it's great that they have a scale as well. That's really good. But yeah, I guess the first most obvious thought is, that picture could have been in color. Yeah.
No, absolutely. I don't think I would have not complained so much, but noticed as much if the one directly next to it wasn't in all colors. But yeah, no, I think it's a gross postmortem photograph of the mass that they've removed. There isn't a photo of the mass in situ. There's a description of the colors. But again, I think a colored photo would have been much more useful to future clinicians. Even if you were just doing exploratory surgery, or if you were doing something else and you came across something similar, you could have like, oh yeah, I've seen that somewhere in a paper. Let's go check it out.
Yeah, my idea of dull red brown is probably not the same as everyone else's idea of dull red brown.
No, no, definitely not. I think yeah, when it comes to color, it's important to have a good visual of it.
Yeah, we've got a comment. So at the end, they call this a very unusual case. It would have been interesting if they hypothesized more for the potential connection between the two brothers' similar cancers that occurred around the same time, such as suggest possible cause that led to these connected cases. That's a really interesting point. I think before, when we discussed this, just before we started the call, like that actually came up, was the fact they don't relate the brother's cancer in any way, shape or form to this, which seems kind of really stupid. Like it seems quite ridiculous not to. It's like
not especially to have done that,
yeah, that they're not just like what's it like cheetahs in the same enclosure. They're not just enclosure mates. They are related. So I mean, is there a genetic cause? Is there a background between it, or is it just infectious? Like it's yeah, very good point there.
Absolutely, yeah. I think the somewhere towards the end of the paper, they do note that like they do try to hypothesize. I'll just see if I find it for anyone who's not read it. So after these figures and stuff and discussing the clinical case, so they do go into a bit more about the lymphomas and these reports and stuff. But I almost wish this was at the beginning of the paper to give this more of that emphasis. But they do talk about they start to refer to Cheetah 2 on page 5 of the paper. They do mention him obviously briefly beforehand, but it is almost concerning that it appears to be that they've given such little regard to the fact that they were related and both died from quite similar diseases within 4 months of each other. And given that yes, they were both 13 years old, and after Googling, apparently cheetahs live about 12-14 years, so they are old. But just in general, I feel they should have explored this more. So in the sentence, they say, like, possible etiologies explaining this dual presentation include genetic, environmental, or infectious causes. but make no attempt to go into that further, which I found to be quite disappointing almost. But yeah, so here again, like they mentioned a bit, that the cheetahs exhibit like the low levels of genetic diversity compared to other ones. So there's more problems in terms of infectious diseases and breeding them in captivity. I don't know if anyone knows, but as with most zoo animals, most cheetahs are genotyped, and so that if like zoos are trading animals, or if they're trying to relocate cheetahs, they'll try and locate it to a zoo that is obviously suitable for it, but also where there is, for example, a breeding pair, like an option to make them a breeding pair, and they are also genetically distant from each other. For anyone who doesn't know, cheetahs went through like a really narrow genetic bottleneck about 10,000 years ago, or 1,000 years ago, something with a 1, and basically lost quite a lot of their population. So very few numbers of them. So their genetic pool now is very, very small compared to that of other large cats. So where I'm going with this is almost if they are part of these programs of moving cheetahs around, or if they have the genotypes of these cheetahs, obviously they're also a zoo, so it may have been financial constraints, but I almost don't know how much more effort it would have been to just see if they had something, if it was something that stood out and that the brothers shared that may have like genetically caused this. But yeah, we'll go back to the figures. If anyone else has any points, go on and send them in. So there's also 2 histology slides presented here, which again I think are really, really useful in terms of if you are a clinician trying to diagnose this. You have an animal with a mass and you're not sure what to think of it, and you aspirate it and stuff, and put it on a slide, and you see this, and again, like if you've seen this paper and stuff, or you go looking for it, it's something to compare to. And I mean, I've not really got anything to say about these 2. I think they're pretty good. They've got their scales, they've got arrows, they're in color at least. But yeah, I don't know if anyone else has any comments about the figures or their relevance.
I suppose throughout the paper, it's all of the references are quite retrospective, in the sense that we're basing it on like principles of cancer and how cancer works, but in small animals, and kind of trying to apply that to wildlife species. I guess it's just such a limited research area that there isn't a lot out there on, cancer specifically in cheetah. But I suppose it's something to just bear in mind as it's being read, that, and it's not wholly discussed, I suppose, either by the writer. So I just sort of take it at its word that oncology is the same no matter what species you're looking at, and in particular when you're looking at the cytology, assuming that that's quite representative of what you might see in a cat, for example, if that was what we were looking at.
Definitely, yeah. I think when it comes to this, again, if they were reporting this in a dog or a house cat and stuff, I think we would be maybe less critical of some of the image presentations. But I think it is just because the species is quite different and yeah, like the field is a lot smaller, I guess, at this point in time. But yeah. Any comments or anything at the moment? If not, we'll move on.
I don't believe we've got any at the moment, so we'll head on to the next section, I suppose.
Fabulous. Okay. So yeah, so I mean, throughout the paper, they do just, again, they're just discussing every single aspect of this cheetah in a lot of detail. Their 2 small ulcers, pyloric, just absolutely everything. And while I think that is really, really good, sometimes I'm always wondering like how much of this was relevant specifically to the disease, or it was just this is all of the signs of this old cheetah. But yeah, so I think so yeah, as we mentioned here, they do give a bit more of a description here as to the importance of the disease in general, how, like, just a bit more about the cancer. But yeah, as I said, I think if this was a laboratory paper, you would expect this to be in the introduction. But yeah, so they do make this claim that this is the first case reported of multicentric T-cell lymphoma in the cheetah without evidence of FELV infection, and only the 3rd documented cases of lymphoma in this species. And I wonder if So if this is the third, if the second one was the brother, I think they do mention somewhere. I don't know if anyone else remembers what the first one was. But I mean, it just goes to say that they don't really have a large base to bit, like a large, I guess, knowledge pool to base any of their findings on or anything. So they are just reporting absolutely everything. But yeah, I think they do these the FELV and feline infect and immuno. I forgot what the virus is. Immunodeficiency virus. There we go. Sorry about that. And they do say that they rule them out, but I don't know if any of you have ever heard your lecturers say, but tests can only rule diseases in, but they can't actually rule them out. But yes, but this point as well, I think it was brought up with one of the comments earlier, was that they really haven't dwelled on this second cheetah nearly enough. Well, I guess the first cheetah brother. And I think this whole paper and this whole case would have been a lot stronger if they had a detailed post-mortem of the first cheetah included. And I understand that the diseases and the cancers between them are obviously different, but it would have been good to compare them, given as well that they were both FELV positive. Sorry, not positive, negative. That this is two cancers that are apparently normally associated with these two viral diseases, and they've both shown up in related cheetahs in captivity. But yeah, I can't remember if they go on to say anything else that I found important.
You highlighted earlier the importance of genetics in cheetah, in particular, mentioning kind of the fact that cheetah are often moved around between different zoos, and genetics is so narrow that, and the fact that I suppose no further description as to why the genetic testing wasn't able to be carried out. It could well be due to lack of funds, lack of time. Perhaps it's out with the scope of the paper. But it was such a critically important point, as you've said, because this cheetah number one was referenced so often, and yet there was sort of this huge gap that was missing. I don't know if anyone else felt something similar as to what significance that had. And I just know that's been highlighted throughout quite a bit. So, yeah.
Yeah, I think, I mean, with the whole genotyping thing as well, like it would, like one sentence that said, oh, this like was outside of the scope of the paper, or like unfortunately we didn't have the funds to carry this out, but like the data's there for if like we get the funds in the future we will, or something, and then we'll further report on it. It's also just, especially with captive breeding programs, if you do identify a genetic factor that causes diseases such as this, it would then obviously be advisable not to breed from those animals. But without knowing what those genetic factors are, it's just very likely that if these cheetahs had any other relatives and those were bred from, like, it's very likely that this disease will occur in other cheetahs, and this won't be the first case. Well, it will be the first case, but it won't be the only cases anymore. I think so. They do go through quite a lot of so like environmental factors could play a role in the diagnosis of lymphoma in cheetahs, including like the chemicals and stuff. But again, they didn't really analyze the environment. We have no real information about their husbandry, so it's almost like they haven't analyzed it, but we're also given no chance to get any insight into the, like, so they say there were no known carcinogens, but it's impossible to rule out the factors entirely. But it is just almost, again, we're not really given the information, or like for us to try and work with. But yeah,
sorry.
No, go on.
I was just gonna add that, like, for such a big first, I feel like you only find out that it's a first when you sit down and focus on it. And I don't know, I'm not familiar with if journals do this, but maybe they could have included it in the title. Would that be something that they could have done?
Yeah, no, absolutely. I think that's something they're in their full right to do and stuff. And if they're this confident in their claims that this is the first multisystem lymphoma thing report in Cheetah of this type when they're FELV negative. Like, the title can always be more descriptive. They do mention it in the abstract in the last sentence, but I think it kind of gives off the feeling that they're either not very confident in their findings, or they're lacking the supportive evidence to make their claims like louder almost. But yeah, it also just could be the writing of the paper, and as all of us probably here listening know, vets aren't trained to write. Most of us probably stopped writing English at about year 10, year 11. So I don't know. Sometimes when I'm being critical on a paper, I kind of just wonder how far to go with it. But yeah, I think so. This last paragraph here is just what I've highlighted in terms of their like actual final conclusion, kind of. And so they obviously say that this report is very unusual because it describes this disease in a cheetah that obviously had to be euthanized, and then 4 months after its 13-year-old sibling died. And then additionally, this case not only emphasizes that this disease should be considered in cheetahs displaying non-specific clinical signs, but also they say like can demonstrate the application of viral metagenomics in a case where possible viral etiology was suspected in unfamiliar species. I think we skipped over that, so actually let's go back to the viral metagenomics bit. So it's just the paragraph above, which is I think why I skipped it. So they basically say that viral metagenomic sequencing is culture-independent method, and it's used to sample the genetic composition of viral populations. This method is used quite often when they're trying to, I don't know if anyone has ever heard about it in the news and stuff, but when they're trying to trace, especially for court convictions, for example, like where HIV originated, or like if a person is being convicted for any form of abuse or I think there was a case where a doctor, sorry, I'm going a bit off topic. There was a doctor that gave hepatitis C to 191 patients of his, because every time he went to go do the anesthesia for the surgery, he would use the needle and use the dose a bit on himself before giving it to the patients. And so through the viral metagenomics, they were able to trace who it came from by tracing, because these viruses mutate really fast. So they were able to trace where the original virus had like air quotes started from. But yeah, so I mean, I guess they're using the same technique here, and it's basically, so they're saying that their metagenomics failed to identify any viral genetic signatures in Cheetah number 2, but it doesn't rule out possible viral etiology. Again, they didn't test it on Cheetah number 1, and I think this tends to be quite a common case in wildlife or in zoos now. I think, especially in the UK, I don't know if people know, but I'm pretty sure like any animal that dies gets post-mortemed. But it is often the case that if you have one death that wasn't actually that suspicious, you let it go. Like, for example, in the case the cheetah was old. But if you have 2 close deaths and the second one is considered suspicious, and into that one you do a forensic and pathological investigation. So this possibly explains why they didn't do anything that distinct with the first cheetah. But yes, so I don't know if anyone has any more comments about the paper in general. If not, we'll just discuss the conclusion a bit more.
Just wondering, I haven't had a full chance to read every bit of the paper, but is there any suggestion for future work, or like any suggestion for like future investigations or studies? Or
that's a good point. I think I did note it down somewhere, but it's definitely not a highlighted point. Again, because this paper is all just one block of text under the title Brief Communication, you tend to lose yourself in it a bit. But I think, to my recollection, I don't think there was any sentence that clearly stated like future things should look at this, or like if we get more resources, or if this happens again, this is like the main things to look at cheetahs, or like cheetahs should be tested for this. The only indication that I can see or know of is just this. So like This case emphasizes that multicentric T-cell lymphoma should be considered in cheetahs displaying non-clinical signs, but that's not really a future like point of work. That's just kind of like, hey, take note. But yeah, we can definitely discuss. I don't know, like with normal journal, well, not with normal, but as in with other journal clubs, it's often that like we'll try and suggest some future directions for papers. So I don't know if anyone has anything they think would be a good future study or would be like a good next step. Obviously in a perfect world where finances and time is not an issue.
Well, I guess since it's more of like a case study, I guess the obvious best case is that every other cheetah that presents with this is documented in maybe a slightly more improved way, so like slightly more figures, lesions in situ, like small details like that. Yeah, because it's not like a traditional research paper. I'm not sure what else. Yeah.
No, I think that's a really good point. I mean, at the end in this, they don't really have that kind of call to action. It's obviously not their responsibility or anything to do that, but it would almost be good if they just mentioned kind of like, if you have like a cheetah, or if you have an animal that dies from similar signs and you want to like share your results, we'll be compiling like we'll be compiling the data that we have here into a database and hopefully like add it with whatever the first animal to have this, not the first animal, the first cheetah to have this was as well. So I think that would definitely be really good. Like if this happens in future, let's compile that data and make it into something useful and an actual like useful resource for continued future use. But yeah, other than that, I don't know if anyone else has any ideas of like future direction that we could go with from this paper.
No, I just completely agree with everything that you've said so far. And like I say, if money was no object, that to use any possible additional testing, or especially genomic resources, would be great.
Yeah.
We just had someone ask. Sorry, I joined for 6 p.m. for the journal paper part. But have you guys already done the majority of the paper? Unfortunately, we are sort of at the conclusion of the paper. However, this is recorded, so you're more than welcome to make sure you can watch the whole thing through again after the live is finished. If you do have any questions, please feel free to still post them in the comments, and we'll be happy to go back and discuss those now.
Yeah, absolutely.
Yeah, sorry about that, guys. There was a very last minute change of plan because Dr. Peter had to run off to an elephant blood transfusion. So hopefully he's joining us soon. But yeah, sorry about not mentioning that.
Yeah, no, I mean, yeah, again, like it was pretty last minute, but if you have read the paper and if you want to comment anything now regarding any of the figures or the presentation or anything, we'll be happy to discuss it. And yeah, it's been recorded and stuff, so you're welcome to watch it through. And if people enjoyed this, we'll probably try and do this again.
Yeah, feel free to message TEP ambassadors as well. Like if you've got any comments or questions or anything, that's like our little group Instagram. So just like at TEP ambassadors, just send us a DM and we can get a conversation going if that's what you want to do as well.
Yeah, absolutely. And I think as well, if you find any other interesting papers, like basically the way I found this paper was I went onto Web of Science, which is like a place that has quite a lot of the papers and resources and stuff, and basically just typed in cheetah, and this was one of the only published papers that had been peer reviewed and I found to be of interest and possibly relevant to some of the stuff we're doing, because obviously quite a lot of people, I'm hoping now, will have like done the cheetah module, and so some of this would be familiar, and even if it isn't, if you've done clinical or if you're a vet student and stuff, this will be of interest to you. But yeah, I mean in summary, I guess the paper, like the abstract was great. It like absolutely just gave out all of the information that you needed. The introduction that went to repeat all of that information word for word, which was a bit questionable, but what can you do? And then yeah, I think the general complaints we had was just basically lack of more radiographs. We kind of wanted a bit more visuals, and the figure in black and white of the mass was obviously a bit of a questionable decision on their part, but They must have had their reasons. But yeah, I guess like in general, like really, really in depth for most of the clinical analysis. And again, I think would have been lovely to have it to have at least some of the information into tables. It's also because obviously I personally have never dealt with a cheetah, and I don't know any of the reference ranges for any of the values that they spoke about. And again, with zoo vets and wildlife vets, if it's not a species you see common, it again would have been useful to just have that side by side and kind of have that comparison between like normal and then their first check and then their like recheck of all the blood signs, and just see how it progressed and how it changed. And obviously you can't base your diagnosis entirely on just this one paper. You do have to actually deal with the animal you have at hand, but just as a guide. But yeah, I'm not sure if anyone else has any more comments, or if we have an ETA on Peter, or if anyone just has any more discussions they want to talk about papers and journal clubs and kind of whatever you want.
I think now we're actually going to play a fun cheetah video just before we get an ETA on Peter and stuff.
Okay, so, I'll just stop sharing screen.
Mm-hmm.
Did that stop?
Yeah, you're done. Yeah, stop sharing.
Okay, fab.
Yeah, you're good.
Fab.
Okay.
We've been called out now on a Saturday afternoon. It's 38 degrees. And there's 2 cheetahs that have escaped from one reserve onto another. So we've got to get them back because there are lions on this side and the other cheetahs that are going to beat them up. So we can't wait for it to cool down. It's not going to cool down much anyway. Not ideal conditions working in this heat, but we don't have any choice. So it's going to be a little bit risky. We're going to use an impala as bait, so that chances of us getting one out of the 2 is pretty good, but then they're going to both run away. And then what? So we've got to try and keep their attention on a bait, so that when the first one gets darted, that it thinks it's its mate that's bitten it, and either stays with the carcass or comes back to it. And while the other ones, while they're preoccupied, do the other one as well. And then we'll put them in the back of our car, and where it's nice and cool in the aircon, and then take them back to where they came from. We're not sure how they got through. They might have chased an animal through from the one side to the other, gone through the fence, or the electricity might have been off for some reason, or they came through in a warthog. You can see this guy's left front leg is pretty sore, eh? Okay. He might actually have injured it while he was working, while he came through the fence. Okay. Okay. All right, so we'll just get the car going. Okay, start a long-acting shot of penicillin, just for any infections perhaps. Okay, time to wake them up. That guy's injuries, we're going to just have to watch him. Luckily they're quite habituated, so they'll be able to see them every day. Okay, that's the bean. And a half naltrexone.
So a happy ending for that cheetah, but unfortunately, it sounds like a happy ending on Peter's side is not happening. We're still waiting to hear from him. He said he would give an update during the course of this last hour. He is clearly caught up with the elephant blood transfusion that he wasn't too hopeful for a good outcome that side. So fingers crossed, we're still going to get good news from him and he'll be able to join us in the next few minutes. I thought it might be interesting just to finish off that very interesting sort of Journal Club article debate by posing a little ethical debate question. Now, with everything that's happening with COVID at the moment and tourism restrictions really impacting game reserves around not just South Africa but around the world, as well as zoos, and there's been a lot of news about Chester Zoo. In the news recently as well, obviously really struggling and looking for funding to keep things going their side, and very much similar situations happening in South Africa. So I wanted to pose a little ethical debate to the panel and the audience, so you can submit your thoughts. So let's say, for example, captive breeding center X is really struggling with funding because of no tourism, and they now have three options that that's been put on the table in order to try and help the situation. So option number one is sell their animals to an international zoo, and obviously the quality of life is going to be quite low in that sense. And very different from quite a high quality of life situation that these animals are used to in the breeding center. Option B is actually release these animals into the wild. Now, because they captive bred and ultimately do want to be released, but not up to the standard that they can be released just yet, the chances of survival would be low. Or option C is euthanasia. So I'd love to hear the panel's thoughts on that, and then also some comments from the audience, see what you guys think if you would choose option A, B, or C. Obviously, all have their pros and cons. Option A would be the most financially beneficial for the center and probably prolong the life of that center and that center within the community and education, that side. But wouldn't be a very ethical option, obviously. So I'd love to hand it over to the panel and see what you guys think.
I mean, so the main consideration here is like the animal's quality of life. So like I feel as vet students we're constantly told it's quality of life first. And I don't think the option to release is essentially like kind of dooming them to eventual death because they're not going to be able to handle themselves in the wild. The option to home them in a zoo, while financially okay, will probably cause them loads of stress-related concerns. There's all kinds of complications that could come with switching up their husbandry and stuff like that. Which is why I personally would go with euthanasia, even though that's like absolutely the saddest outcome for the center, for the animals, for everyone. But yeah, I don't know what you guys think about that.
I mean, yeah, no, it's definitely a really, really difficult situation. I think blanketly, if it was a situation presented to you like this and you didn't have more information, I think I definitely agree. Like as vet students and stuff, the animal's welfare is coming first. So euthanasia would probably be the more ethically correct option to choose. I guess if you were starting to delve into the case, and if you knew it on a personal level, I guess the animals be in captive breeding. I guess it depends what kind of animals it is. Predators and stuff would suffer quite a lot being released in the wild if they've been like not hand fed, but as in provided their food very easily throughout their life. But things like grazers and that may have a better chance, and it depends if they have a program maybe in place to just, I don't know, to help with the rewilding, I guess, of these animals. So I guess that would be one of the considerations. And I guess as well, like how how many animals and how many people this affects and stuff would all play into it. Like, it's as vets, I think it's quite straightforward to say, like, yes, euthanasia, but as people and given the situation, I think it'd be a very difficult decision to make, and there'd be quite a lot of factors that play into it in the end. I'm just reading the.
And anyone else got any thoughts? Layla, any thoughts jumping out at you?
Yeah, it does seem such a shame to put an animal down rather than house them in a zoo. Obviously, you'd have to look at what the welfare of these. I think it would be a very sort of situational decision. Like, if you knew the cheetahs, you knew their age, you knew what sort of their possibilities were. It seems a real shame to put them down, but I think if there was no good place that you could house them where they're not going to be properly stimulated, then I think probably euthanasia would be the best option, because you couldn't put them back in the wild. But I think as a vet on that case, it would be a really difficult decision to make.
Yeah, I think I completely agree with what everyone said so far. As from a veterinary perspective, we're very much drilled into us that we do no harm, that the animals come first. We know it's more complicated than that, in the sense that financials and human emotions, we obviously deal with owners as well as animals, and this all contributes to final decisions that are made. But ultimately, although euthanasia may, seem the saddest option and also the most devastating option, humane euthanasia, always remember in my mind this phrase ringing around, is not a welfare issue. Whereas with the two other options that are being presented, there are kind of pros and cons to the welfare of these animals, and that we could possibly cause a decline in that welfare. So euthanasia is the most neutral option, although it may not be the most beneficial to the people around those animals, and actually for the animals themselves.
It's it's such a fascinating situation that's sort of happening at the moment, and I think your views are all excellent there. So if anyone's got any comments, please feel free to send that in. To give a little update on Dr. Rogers, unfortunately, it doesn't look like he is going to join us. There was a slight chance he'd make it back in time after having to go and do an emergency blood transfusion on a baby elephant. So unfortunately, it doesn't look like he's going to make it. So really sorry to everyone who was tuning in for him. Hopefully we'll get him back as soon as we can, and possibly maybe see if we can reschedule this so we don't have to wait another month until we do speak to him again. But I thought it might be a good opportunity just to update you on two quick things as well. One is with borders slowly opening up again, and things looking like we should be able to do international travel from sort of June onwards. With South Africa now obviously got open borders, even though it has been advertised that it's a red list country at the moment. We do have options for a wildlife vet experience, which is opening up in July and August, which will give you the opportunity to work with a couple of vets, one of which is hopefully going to be Dr. Rogers as well, depending on his availability, and also meeting some of the staff and working at Hoedspruit Endangered Species Centre, and also staying on a fantastic reserve and some really nice tented camp accommodation. But it is a chance for you if you're happy to travel and head out to South Africa over the summer months. Northern Hemisphere southern months, the winter for South Africa. It gives you a chance to spend 2 weeks shadowing a couple of really experienced vets, working on some reserves, seeing some cheetah breeding centers as well, and getting involved in the community as well, and seeing how conservation in the community works as well. So fantastic opportunity. So please do get in touch if you are interested in hearing more about that. The second thing I wanted to mention, for those of you that are enjoying the courses that are sort of happening so far, we're just about to launch a biomimicry online, a series of biomimicry online modules, which is a fascinating topic. For those of you that don't know what biomimicry is, I suggest go and check it out. But let me just show you a quick intro video just to give you a little bit of a taster for it.
An experience that reveals how nature is a vast library of ingenuity we can learn from. A library filled with proven, real solutions for all our human development and sustainability challenges. Solutions based on the billions of years of research and development by the natural world's designers, architects, engineers, and scientists. This is the science of biomimicry.
So really excited to get stuck in with those modules. We've been working on them for a few months now, and it's a topic that is super, super fascinating. For those of you that don't know what it is, go and check it out. Really is interesting. What about the panel, just to finish off? You guys know much about biomimicry?
I have to say, I don't know all that much. I maybe heard the word thrown around a bit, but my knowledge is very limited. But it looks fascinating, really cool.
It really is. How about you, Yashu? You know much about it?
No, I just know the biomimicry of like the coral snake versus the corn snake, and that's like one is super poisonous, one is very much not poisonous at all, and it's really cool, like the ways that nature comes up with to finesse the system. I think it's amazing. Yeah, it's just brilliant. One of my favorite topics. So
amazing. And Kat, I believe in the background you're helping with some designs for these modules.
Yeah, just drawing a couple things for it as well. But yeah, no, I'm really excited. It's similar to Yashu. Like I have some awareness, I guess, of the like how in nature it's kind of used, or how like sharks use bioluminescence and stuff to trick other animals to think they're actually a really small fish and kind of things like that. And yeah, like the coral snake or butterflies pretending to be not butterflies and all of that. I think it's really, really cool. But I'm really, really excited. That video has got me hyped. I can't wait.
How about you, Layla?
I've heard of biomimicry, and it's something that was sort of like thrown around sort of during GCSE and A-level teaching, sort of at the end of learning a module and stuff. It's sort of something that was mentioned as being a future development. But yeah, it looks really, really awesome. Like don't know much about it, but very excited.
I would love to get more young people involved in that as a career, and just have biomimicists all over the world doing those kind of things. I think the thing that really got me excited years ago when I first heard about it was learning about termite mounds, all over Africa. And one of the things that's fascinating about them is quite a lot of Africa can get really hot during the middle of the day, but really cold actually at night as well. And these termite mounds were just staying at 37 degrees constantly, winter and summer, no matter what, all just through, the way that their tunnels are aerated and the way that they're letting in light here and there and stuff like that. And I mean, it's just so many examples of this out there that, if we were to take on board some of these things, more, we could just solve so many of our design, production, energy issues out there. And it's just such a fascinating topic. So yeah, please do sign up for that when it does come out. So once again, just a big apologies that Dr. Rogers couldn't join us due to getting called away on a wildlife vet emergency, which is the life of a wildlife vet, I'm afraid. So just a big thank you to Kat for hosting the Journal Club. That was fantastic. Really hope that's going to be the first of many. If anyone's going to watch this on replay, send through your questions and comments, and one of the panel will get back to you. And also, as they mentioned, send through any ideas for future articles that you want us to tackle, and hopefully we can do one again next month. To the rest of the panel, Layla, thank you for joining us this time. Nirvana, Yashi, thank you so much. Molly, who had to duck out, thank you, everyone. And that's pretty much it from us. I'm sorry it's been a bit of a diverted live stream, but thank you to everyone for joining us. And yeah, please keep in touch and keep sending through comments, and yeah, just keep in touch, guys. Thanks so much, everyone. Take care.
Thank you. See you guys.
Thank
Bye.
you. We'll see you. Bye, guys.